In order to keep one's physical and mental health in good condition, exercise is essential, but just like other activities, it must be done in a balanced manner. Overtraining and exercise-induced stress are both conditions that arise when the body is subjected to an excessive amount of physical activity without receiving sufficient rest and recovery. This can have a negative influence on both performance and health if it is not controlled properly but is allowed to continue. It is vital to first recognize the indicators of exercise-induced stress and overtraining and then execute effective ways to avoid them in order to gain an understanding of how to prevent and manage these concerns. Having an understanding of the stress that exercise causes. When the body is subjected to physical activity, it naturally produces stress, which is a natural aspect of the body's adaptive reaction. After engaging in physical activity, your body experiences a brief period of stress, which, when followed by sufficient recuperation, contributes to the development of strength, endurance, and resilience. On the other hand, exercise-induced stress can become dangerous when the equilibrium between stress and recuperation is thrown off. One type of stress is known as eustress, while the other type is known as distress. The appropriate amount of exercise-induced stress causes the body to adapt, which ultimately results in improvements in strength, endurance, and fitness. This phenomenon is referred to as eustress. This particular form of stress is advantageous and helps to maintain health. When the body's capacity to recover from stress is exceeded, it manifests as distress, which can appear as physical exhaustion, diminished performance, mental burnout, and emotional imbalance. Distress is caused when the stress surpasses the body's capacity to heal. Exercise-induced stress manifests itself in both the body and the mind. Excessive physical stress can manifest itself in a variety of bodily symptoms, including persistent muscle soreness, joint discomfort, higher resting heart rate, recurrent illness as a result of a compromised immune system, and interrupted sleep patterns. Irritability, anxiety, a lack of enthusiasm, difficulty concentrating, and feelings of burnout are all mental markers that your body is not coping well with the stress of exercise. If you have any of these symptoms, you should seek medical attention immediately. Gaining an understanding of the overtraining syndrome, OTS. Individuals are said to be overtrained when they engage in excessive physical activity without providing their bodies with sufficient time to recuperate in between workouts. Overtraining syndrome, OTS, is a disorder that is characterized by a chronic imbalance between training and recovery. This condition results from overtraining over a period of time. Reasons for excessive training: an excessive amount of volume or intensity. Overtraining can occur when an individual engages in exercises of a high intensity or when they engage in lengthy, rigorous exercise sessions without taking adequate recovery. Inadequate rest and recovery. Overtraining frequently happens when rest days are either taken insufficiently or omitted altogether, which prevents the body from recovering to its full potential. The body does not receive the essential nutrients to repair tissues and recover from exercise if it does not obtain sufficient nutrition. This has the effect of worsening the effects of overtraining. Psychological stress. When combined with physical exercise, mental and emotional stress can contribute to overtraining by placing a strain on the neurological system and total energy levels. What are the signs of overtraining? Overtraining is characterized by a number of physical symptoms, including persistent fatigue, an increased frequency of injuries, protracted muscular soreness, an elevated resting heart rate, and decreased performance. A decrease in motivation, impatience, difficulty sleeping, melancholy, and worry are some of the mental symptoms that can be attributed to overtraining. When it comes to training or competition, athletes may also experience feelings of apathy. Hormonal imbalances. Excessive exercise can disrupt the hormonal equilibrium, resulting in a reduction in testosterone levels and an increase in cortisol, the stress hormone. This imbalance can have a detrimental impact on cognitive performance, muscular recovery, and immune system function. Managing exercise-induced stress and overtraining. The maintenance of equilibrium is the most important factor in preventing and controlling stress that is caused by exercise as well as overtraining. The following are some practical measures that can assist in the management of stress and ensure long-term gains in performance. Relaxation and recuperation are essential. Appropriate rest days at regular intervals during a training week. Schedule rest days for yourself. For the purpose of minimizing burnout, restoring energy storage, and facilitating muscle recovery, these are absolutely necessary. Active recovery involves incorporating low-intensity exercises into your routine with the goal of promoting recovery without putting more stress on the body. Some examples of such activities include walking, swimming, and yoga. Make sleep a top priority and strive to get between 7 and 9 hours of quality sleep every night. The healing of muscles, the regulation of hormones, and the function of the brain all benefit greatly from extended periods of deep sleep. Intake of nutrients and moisture. Ensure that you are consuming a diet that is abundant in macronutrients, carbohydrates, proteins, and fats, as well as micronutrients, vitamins, and minerals, in order to boost your energy levels and heal your muscles. Consumption of protein is very crucial for the reconstruction of muscle tissue following muscular exercise. In order to assist muscle recovery and replace glycogen stores, it is important to take a balance of carbs and protein after the completion of strenuous workouts. Hydration. The presence of dehydration might make the effects of overtraining even more severe. As a means of preventing weariness and promoting recovery, it is important to drink plenty of water throughout the day, particularly during and after physical activity. Periodization in workout routines. Programs of training that are structured. Through the process of periodization, your workouts are organized into cycles of changing intensities, which enables you to achieve your maximum potential without inducing overtraining. As an illustration, you may alternate between weeks of high intensity and weeks of moderate intensity in order to give your body the opportunity to recover and to prevent burnout. By incorporating deload weeks into your training program every few weeks, you will be able to give your muscles, joints, and nervous system the opportunity to fully recuperate. Deload weeks are characterized by a reduction in both intensity and volume. Participate in a variety of exercises known as cross-training in order to lessen the amount of tension that is placed on the same muscle groups repeatedly. In addition to boosting general fitness, cross-training helps avoid injuries that are caused by overuse. You should pay attention to your body. Keep an eye out for warning signs. Take note of how your body is feeling at this moment. It is possible that it is time to lower the amount of training you do or to take a longer break if you are experiencing persistent pain, exhaustion, or a lack of motivation. Evaluation of mental health. Exercising to the point where it becomes intellectually or emotionally draining could be an indication that you are overtraining. It is possible to improve mental resilience and stress management by incorporating mindfulness practices such as yoga, meditation, or deep breathing into one's activities. Measurement of the heart rate. Having a resting heart rate that is increased for a number of days can be an indication of overtraining. You can have a better understanding of when your body is experiencing an excessive amount of stress by using a heart rate monitor to track the variability of your heart rate. Exercise-induced stress can be mitigated by the use of recovery techniques. In addition to getting enough rest and eating well, there are a number of recovery practices that help improve recovery and lessen the likelihood of overtraining happening. The use of massage and foam rolling. Foam rolling also helps relax muscular tension and enhance blood flow, which in turn reduces muscle discomfort and speeds up recovery. This technique is known as self-myofascial release. Treatment of the massage. Massages performed on a regular basis can assist relieve muscle tension, increase circulation, and contribute to a reduction in stress levels of both the physical and mental variety. The treatment of cold and heat. Cryotherapy and ice baths are two forms of cold therapy that can help reduce inflammation, muscular discomfort, and recovery time immediately following strenuous exercise. The application of heat, such as by using heating pads or taking warm baths, is a form of therapy that helps relax muscles, increase circulation, and promote recuperation. This is especially beneficial in situations where muscles feel tight or stiff. Practices of relaxation and mindfulness are included. The practice of yoga and stretching. Including yoga or stretching practices in your recovery days will help you become more flexible, enhance circulation, and relax your mind. Meditation and deep breathing exercises are effective methods for managing mental stress and lowering cortisol levels. These techniques also promote a calm and concentrated mentality, which is beneficial for training and recovery. When do you need the assistance of a professional? Consultation with a healthcare or fitness professional can be beneficial in the event that you are experiencing persistent symptoms of overtraining or if you are unsure of how to change your training plan. Nutritionists that specialize in sports, physical therapists, and coaches are all specialists who can offer advice on how to maximize your training and recovery. When the condition is severe, it may be important to seek medical attention in order to manage hormone imbalances, persistent exhaustion, or injuries that are the result of overtraining. If you enjoyed this video, give it a thumbs up. If you have any questions or feedback, drop a comment. Don't miss out on our latest content. Hit that subscribe button now.